Hi, this is Amy Baez, Pediatric Occupational Therapist and founder of Playapy, here with the first episode of a new series called Tips and Topics. So, you may be familiar with my series, Amy's Affirmations, which is really much more about encouraging words for parents. But this series is more informational and gives specific tips. And when I wanted to start out with you today with something that is pretty basic but very important, and that is, what is occupational therapy? Now, I picked this topic first. One, because it is National Occupational Therapy Month in April, but also because it is a question that I get asked over and over and over again, even though I have close to 2 decades of experience. And that is because most people don't have experience with pediatric occupational therapy unless they have a personal experience with it. Now, what is it that I'm talking about? So, occupational therapy is a medical field, and our job is to help people to reach their fullest potential. And they are often introduced to us because of an injury, an accident, or maybe a developmental concern. Now, I work in pediatrics, and most of my cases are usually children that have a developmental concern, meaning that they were either born with an issue or are having trouble with their developmental skills, or maybe their environment and their lack of participating in certain activities or being exposed to different things has caused them to have developmental delays. So what does that look like? Well, for occupational therapy, we often work with children with fine motor delays. What are fine motor delays? Basically, if you have difficulty with using these small little muscles in your hands to do particular skills, you might have a fine motor delay. So for children, that often shows up as they're progressing and maybe missing some milestones. Maybe they are having difficulty with stacking blocks, and then maybe that translates to not being able to hold a fork properly. Or maybe they can't tie their shoes, or they're having difficulty learning how to draw or write. Those are some of the things that we particularly work with. We also work with their attention spans and their behavior. We're working on their cognitive skills. How well can they follow directions? How long can they sit and listen to someone? How well do they respond to stimuli in their environment? Now, a lot of therapists are seen for help with the sensory system. And we all know our 5 basic senses, but there's also additional ones which I can discuss in another video that really can affect how a child is interpreting the world around them and how they're interacting with others. And this can be very disruptive if they're falling outside of a normal range of behavior. So that is another area that therapists work with. I also work a lot with coordination skills and strength building, and so I get labeled sometimes as a therapist by parents instead as a trainer. They say, like, you're like kind of like my kid's trainer, and some call me like their teacher. And I'll take anything in terms of whatever they want to call me. But the difference is that I'm really looking at it from a medical perspective. I'm really trying to investigate and figure out why it is that this child is having these concerns and difficulties, and how can I solve this problem for them so that they can reach their fullest potential and do everything that their parent wants them to be able to do. And so I really feel like this is a job that it's more than a job. It's more than a career, and in some ways it feels a bit of like a calling. You have to have a certain love for children, a certain level of patience for children, and a desire and will to work with them. Sometimes it can be so easy, and I think, wow, I can't believe I'm getting paid to do this. I get to just play with kids. And then sometimes it can be very difficult because you're working with children through some of the hardest things that they have to deal with, and sometimes it doesn't look pretty, um, and sometimes it can be very difficult. But I try to make it a lot of fun, and that is because I really focus on what a child's main occupation is aside from learning, and that is play. And that is one of the things that therapists do, is that we use activities, and with children it's often play, to help them to develop these skills and improve the skills that they need to. And so it may look like they are going to have a great time in their therapy session, and we hope that they do. And that is how therapists are really effective in helping children to develop these skills that oftentimes others do not know how to help them with, and that's because we have extensive training in order to do so. So that, in a nutshell, is what pediatric occupational therapy is. And if you'd like to learn some more, I have attached a link to a blog that I've written that gives you a little bit more detail. And there's plenty of information on playapy.com for you to learn some more. If you'd like to learn different terminology, learn about the different developmental skills that we work on, there's all kinds of information in our resources section for you. So in the meantime, I hope that you enjoy April and introduce yourself a little bit more to occupational therapy, and I hope you have a playful day. See you soon.